state of crisis. When we think about the prevalence of gender-based violence in our country, when we also think about the severity of these particular cases, but also when we think about the lack of access to justice. Because it's really one thing for persons to be faced with a challenge, to be faced with gender-based violence, but there's the issue of how people are finding it difficult to put their foot in the door or in the room, rather, really to have some kind of remedies for their particular issues. But before we get to the access to justice perspective, I want to bring in Valini first, because there is this whole belief in our country and in our culture where we seem to think that something is really wrong with persons who stay in abusive relationships. And so I want to hear from you, Valini. Can you really tell us from your experience, but also from your professional experience, why do you think so many persons remain in abusive relationships? What's really happening?
Good afternoon, Kobe. Thank you for having me on the show. There are a number of factors why victims would stay in abusive relationship. First off is shame. Many times we think about what would society say, what would people think of us if we leave this situation, the relationship. Also, because of financial constraints, many times the abuser might be the breadwinner and might be the person who is working and taking care of the family, and the victim really wouldn't have anywhere to go if she exits. Or no, in a lot of times you would find the woman might not be as educated to get a job, or possibly never worked in her life. So now to exit a relationship where she basically has to be on her own, it becomes difficult, and she thinks about that. Where will you go? You know, many times in abusive relationships, you are kept away from family and friends, and you become the abuser's property. So now when you exit, after not seeing family for 3, 4, 5 years, however long, and then just one day you show up with 2 or 3 children, you know, many times people think about that. Where will I go with my children? How will my children survive? You know, and with that, you find a lot of women staying, and most importantly, thinking about your support system. Thankfully for me, I had very supportive family and friends and colleagues who rallied around me. Not many women can say the same.
Thank you for sharing so deeply, Valini, in a very open way. I know we have Ms. Pamela Knott, representative from Help and Shelter. Pamela serves as secretary of the Help and Shelter Board of Directors. Ms. Knott, thank you for joining us this afternoon.
Hi, Kobe. Good afternoon.
Good afternoon, and thank you so much for joining. So we know that Help and Shelter, whenever we think about domestic violence, response and prevention, the first name that comes up is Help and Shelter, or one of the first names that come up would be Help and Shelter. And so we really heard from Valini about the issue of entrapment. What's really this cycle that really keeps persons within abusive relationships? And so I want to hear from you, Ms. Knott, based on your background and your experience within the field of responding to cases of domestic violence. Why is it, do you think that so many persons remain in abusive relationships?
Very good question, Kobe. And it's something that we've been asked in a long time. But just to go back to what you talk about in terms of the experience, Help and Shelter has been around for a long time. And I think because we have been there and well established and work in this area, throughout the years, you gain from experience and you would have learned and, you correct your mistakes and you know what has happened and everything. But because it's like you come with that experience, you bring that to the table. But domestic violence is very, very persuasive. People stay in relationship for different reasons. And I heard the last presenter talking about it. But to add to that, sometimes one of the points I want to highlight that she made is when you have children, and if you don't have a good supporting system or a good supporting mechanism, you tend to go back into that abuse. And what happens to that individual or that victim, if they don't get any support, if they don't have any intervention, they haven't grown. There is no intervention to say, well, you can do things differently. These are the supporting mechanism. This is how you cope. So this is what Help and Shelter does. We help to provide those services, mainly counseling. We help you to grow and develop. We help you to work with a plan that you're comfortable with. It's your roadmap. This is how you would do things differently to get out of that abusive relationship. I can tell you, it's not an easy road, and different individuals respond differently. All right. Some victims, most likely in many, many domestic violence cases, the majority, every 4 women out of 5 are abused. Globally, that's the statistic coming out from the United Nations. Every 4 women out of 5 are in abusive relationship for domestic violence. If you're talking about gender-based violence, that's a different scenario. But domestic violence, it happens in the immediate family environment. That is why it's called so, and it's very, very persuasive. It goes deeply towards our culture, our beliefs, our values, and how we think. And it's something that we can change. Behaviors can change. And if people are prepared to work, what we have done at Help and Shelter throughout the years, and we have continued to do, is not only working with the victim or the clients, we also work with the perpetrators, because something happened there that would have triggered them to behave in this manner. So they also need the help, right? They also needed help. And with domestic violence, you work with the women and you can work with the men. Similarly, with gender-based violence, you work with both. But if you're talking about women in violent relationship, then you're focusing on women and girls. So Kobe, just to let you know, this is not something that we can open a door and so we can eliminate it in another month, in another 2 years, or tie it in with the SDGs and say in 2030, this is what's going to happen. It is a long pathway or a roadmap to changing lives, changing behaviors, and changing how people think towards violence.
Certainly, absolutely. And thank you for sharing that. There are a couple of points that I want to bring out there, but I want to bring in our attorney on the call because, as Pamela would have touched on, this issue of domestic violence has been around for a long time, and there's a specific definition when we talk about domestic violence. It's really violence or abuse that happens within close relationships. So it's really confined to a particular group of persons. So, Carissa, we have in this country the Domestic Violence Act. And I know that Pamela would have talked about the issue of counseling, Delaney touched on the issue of support from family and friends. But how exactly, or in what ways, do the Domestic Violence Act provide protection for persons who are in abusive relationships?
Well, thank you, Kobe. The Domestic Violence Act was specially crafted to ensure that persons, survivors who want to engage the law to give them some kind of protection from the perpetrator is available. Now, over the years, there have been quite a number of improvements to that act and the systems that act enables. Now, one of the simplest would be with respect to a survivor, who may be in danger with their partner and they want a protection order, what you call a protection order. Now, that act provides and has made it a very simple process so that that survivor doesn't have to have means to go and get a lawyer, etc., to get this done. The process has been made quite simple through the act that that survivor can simply, as an example, go to the magistrate's court within their district and make that application for that protection order. That application then goes before a magistrate, and depending on the circumstances, if it's immediate, it may go, and the time also that application is made during the day, it may be taken immediately before a magistrate. And an interim order, that's an interim protection order in that sense, will be granted to that survivor. Now, with respect to, of course, issues where the survivor and the perpetrator reside in the same home, for example, in intimate partner violence situations, you have that act providing for an occupational order where the survivor can make that application again to the magistrate to be able to have that perpetrator removed from the home so that they're safe. So the act over the years has made it quite a simple process, and a process that is not one of any complication, that the survivor can't access it easily, so that protection is there. However, with every system, you do have your little nicks and knacks between, but I think it has come quite a long way, and it is serving its purpose. And with advocates and champions who keep ensuring that the systems are working, we're getting it done.
Thank you for sharing that, Carissa. And that's actually important information there. I want to pull Valini back into the loop here. So Carissa would have laid out the legal framework there for us to say we have an impressive piece of legislation that really lays the foundation for, number one, how survivors can be protected, but also number two, how perpetrators could be held to account for their actions. But Valini, why, based on your experience working with survivors, why, and I mean, Carissa also touched a bit on it to say that the system isn't perfect. Some people still find it difficult. But what are some ways, or what are some difficulties you hear from survivors when it comes to accessing justice? What really are those particular concerns that people have? And how do you think we can really address that?
Okay, so the first major thing is not knowing what sort of access to justice is there. Many persons are not familiar with the laws. Simply, many women, and I travel across the country, when you ask, do you know that you can go directly and get an order of protection? They'll be like, oh, wow, they didn't know this. So continuous education, educating the public that these acts, these things are in place, these mechanisms are here to help and will make things easy for you. So education is the first one. Also, one other problem is when they go to access justice to the police. Many times victims are not taken seriously. I've worked on a number of cases where police officers would tell victims, "What you do the man now? Go back home, y'all gonna make up just now. Man, don't come and waste our time today." Many times what you find, victims would go and make reports, and then a few days later they retract. And over time you'd find the police, for want of a better word, getting fed up, because many times you would hear, oh God, the two of them again. that they keep coming, making reports, and nothing happens. And on the other hand, you find victims saying, well, the police not taking me seriously. Every time I go, they tell me something, so what must I do? If the police not helping me, let me stay and take my licks. And this is what I was actually told by some victims. So two main things: lack of knowledge and feeling that there is no help out there, or the police will not assist when you go to make reports.
For sharing that, Valini. Pamela and Carissa. So Valini talked about some inefficiencies, insufficiencies when it comes to the police force, but we're aware that capacity building sessions are being done with police officers, and so the question has to be, what more really needs to be done to really ensure that the environment that survivors really come into, whether it's police stations or when they're engaging with police officers, how can that environment be more accommodating? So training is happening, but in your own words, based on your experience, what do you think needs to be done more, or what aren't we getting right when it comes to building the capacity of police officers? Is it that we're not doing enough, or is it that we need to do more? What exactly? Because we've been having this conversation for a long time in terms of what the police needs to do and what they aren't doing. So what exactly aren't we doing, or what do we need to do more? So let's take Pamela and then Carissa.
Thank you. The dynamics there are very interesting, and we cannot generalize when it comes to the police force, because we have seen a number of police officers throughout the length and breadth of Guyana who really make an effort to assist the victim or the survivor. Importantly to note, coming out from what we heard, and this is factual, some of the survivors, they go and they retract their statement, right? For whatever reason, various reasons. Maybe they're dependent solely on this perpetrator, maybe they liked him so much, or what. Various reasons. Maybe they don't have the supporting mechanism to assist with. But we have, especially at Help and Shelter, we have been working with police. Even last week, we were engaging 35 police officers, and we have been doing this continuously. So police are trained, they understand the Domestic Violence Act, they understand what is needed, what is necessary. And there's so many systems that have been put in place. Like somebody can go, they have that privacy now where there is a room in certain police stations, not in all, but there is a room there that a survivor can go and she can relate her story. There's supposed to be a doctor there, a medical person, and a social worker or a counselor. So everything is provided there, especially for rape victims. But again, there are gaps in the system. Guyana, we have some strong legislation, and we must give kudos to that. But the implementation and the execution of it is sometimes a constraint. And if we understand the landscape and the terrain very much so, I heard about accessibility. A lot of times people don't have the access to go in. So what may happen, and this is when you talk about equality and equity also across the spectrum, what may be applicable to people here on the coastline is not necessarily applicable to people in the hinterland communities. There are some challenges and constraints there. But again, education, I would like to reinforce and support that. We need to educate the populace much more, especially women. And this has been ongoing. I mean, government has made stride in this. NGOs have been doing this. Level of the community been doing this. Religious groups have been doing this. But it takes much more than this. So one of the things, Kobe, when we talk about how much we have been doing, UNFPA with the Spotlight Initiative has now designed a program that they want to capture it because, again, to reiterate the point, a lot of work is done, but we are not seeing the magnitude or the people really benefiting from it like we thought it should have. So maybe there are some loopholes and there's some gaps. Yes, we have to acknowledge that, but how do we strengthen this? One of the ways we can strengthen this is in terms of NGOs or other agency, Ministry of Human Services, who are working with survivors or victims. If we can collect that data, if we can share it with other NGOs, if we can analyze the data, right? And said, this is what we found. This is where maybe we need to strengthen our services. These are some areas, because you might find people in Georgetown have a better understanding of the DVA. That's the Domestic Violence Act, more than maybe somebody else in maybe say region 1, different parts of region 1 or region 7 or something like that. So it's not an equal access, that I should say, and it has not been equitably distributed, even though we have made strides towards that.
All right. Thank you so much for making that point, Pamela. I want to come back to Carissa. So Carissa, you talked about what really are the provisions within the Domestic Violence Act, how persons don't necessarily need an attorney to access these particular remedies. But Carissa, there are some organizations locally that really provide certain kinds of services to gender-based violence survivors in a broad way. Can you cite some of those particular services that are really important, whether it's legal or otherwise? Because gender-based violence, as we know, is not only a criminal matter, it's also civil in some ways. Those services that are available, and what are some of those organizations that would provide them for the benefit of the audience tuned in to us this afternoon?
Yes, if I may, please, Kobe, just two things I wanted to add to what Velini and Miss, I forgot her name, was saying just now. Now, with respect to some of the experiences that a survivor may have when they go to a police station. Now, the police, as we know, have a duty to assist. And regardless of their own personal feelings or their personal biases, they are supposed to assist a survivor regardless of if they come 10 times or 15 times. Now, Velini spoke about about survivors who may, they start the process and then they don't go through, for example, with the legal process. But we still have our duty as organizations and as responders to GBV to continue to assist them, to hopefully get them to the point where they break that barrier, they break that relationship and move on, to empowerment. Second thing is, one of the critical barriers that we have been noticing quite recently, as we know, we have a lot of migrants in the country. And one of the barriers in making police reports for gender-based violence is a language barrier. And so we have to work, a lot of work has to be done at the level of the police stations, so that a survivor can go and make that report. For example, a Venezuelan migrant who may be a survivor of GBV may be able to go to the station and freely give their report. So that is some of the things that we have to work towards. Now, with respect to organizations that provide these kind of services, we do know for sure Help and Shelter has been around for many years. We have NCC, which is an umbrella society of several NGOs, Help and Shelter themselves being one of them, who provide services specifically in gender-based violence. Now, the services that you can get from these organizations, of course, covers legal, psychosocial and counseling support, and not only legal, but pro bono legal services, where the perpetrator, the survivor, doesn't have to pay for any of the service, right? This is done free of cost, most times through grants or so on, but it is a cost borne only by the organization. So these organizations provide that kind of legal support, and not, as you mentioned rightly, Kobe, not only in the criminal arena for matters that may be before the magistrate's court, but also some survivors who make that decision to break the cycle and may want to, for example, have a divorce done, and these things, but they may not be in a financial position to do so. Another thing a lot of these organizations provide is empowerment for that survivor so that they can become independent in whatever way, especially and particularly financially independent. So these organizations work with survivor from beginning to end of empowering them to break that cycle. And it's they're offered free of cost to that survivor.
Thank you for sharing that, Carissa. Very useful information because um, a lot of persons don't even know that some of these services, or well, a lot of these services are free. They just know perhaps that these services are available, but really and truly, how can they access them? And it's really important for persons to know that, hey, we do have some organizations that provide these services free of cost because not everybody could afford them. Not everybody could afford counseling. Everybody could be able to pay for an attorney, whether it's for
Yeah.
divorce or custody or whatever. And so, talking about gender-based violence response, it's really about money. People need you. If you don't have certain kinds of resources, then you can't access certain kinds of services, and that's just the reality. And so we really need that. The
If I
point I
may
want
add
to
one more thing on that before I go, Kobe, with respect to services offered, we do know also that a lot of these organizations offer safe spaces or shelters for survivors who may, for example, be at high risk or in immediate danger. And so that is also offered by many of our NGOs that respond to GBV. And also we have organizations who have helpline services so that the survivor can actually has a direct point of contact to these organizations when they're in a situation or when they're reaching out for help. So that is also some of the services that these organizations would offer.
definitely, and that's all important because if person a friend or a family member to go to, then it means that they're looking towards society and organizations within the wider society for that kind of support. And so that's really absolutely important for persons to have that kind of alternative. The point I want to come to now is the engagement of men and boys, which is something that, I mean, if we're going to really be honest with ourselves, we have not done too well. I mean, we are doing, but in terms of really moving the needle, we haven't. We're not to the place that we really want to be. But of course, we have been seeing some kind of movement in some ways, because whenever I think about responding to gender-based violence, I think about a diabetes patient where the patient now gets insulin, and insulin is administered to really keep the person alive. And that's really how I see us responding to gender-based violence, but not really going in a lot of ways to the root causes, because some person is abusing their power over another person. And what we find is that we deal with the counseling, we deal with the legal services, we deal with the shelter, but how exactly are we going back to the issue of where is this thing starting from and how we're addressing that? And so to the three leading women on the call, or in the meeting rather, even though we were on Zoom, I want to ask in your own words, how do you see us really engaging men and boys, which is really a wide cross section of our society, young men, middle-aged men, older men, because it really doesn't matter your age. Any person could, in fact, be perpetrators of violence. But that's not also for me to say that men alone are the perpetrators of violence. But for the purpose of this conversation, and with the research we are seeing, is that men are more prone to be perpetrators of gender-based violence. But how do you see us really and truly engaging men and boys? What are we doing? And how could we really improve that? Because we are seeing these cases almost every single day in the newspapers. And it means that something needs to be done. And the question has to be, why aren't we seeing it done? So then we're gonna do, and then we're gonna have the other persons.
Okay. So with men and boys, I think we need to start with a mindset change. Culturally, we kind of push, sometimes unconsciously push patriarchy and power from a very early age with our boys. That is something we need to work on. Like I said, a mindset change. And, we need to gently move away. Girls wear pink and play with dolls. Boys are masculine and boys don't cry, and those kinds of things. We need to introduce alternative masculinities, like telling a boy child it is okay to cry. Always let them know or use examples that violence isn't the answer to correcting a situation. Use different methods, and this needs to start from the home. I would say start from the womb. How you talk to boys, and let them know that it's okay to have emotions. In terms of the change, it needs to start with the family, start in the home, and start with changing the mind.
Thank you
Yes,
so much.
I
Let's
definitely agree with that.
Carissa? Carissa, great.
Yes, sorry.
Go
I definitely agree with Valini on that. We definitely need to promote more positive alternative masculinities as one of the, to really tackle the root of all of this, because, it's a mindset. It's a mindset. So we have to start working from there. The other thing is, we have to, even in situations where they are perpetrators, we have to also work as organizations to design programs to even work with these perpetrators. Many of them themselves have grown in situations where they saw their mothers, their sisters, and even themselves experience GBV in the home. And so we really have to tackle those nuances with them and work with them to get them to that point of understanding, to be caring, to be loving, to foster positive home environments for their spouses, for their children, etc. So,
right. Thank you for sharing that, Carissa. Pamela?
Yeah, Kobe, a couple of things that you said that really brings this into reality. We need a paradigm shift. We have been doing a lot of work, like you rightfully pointed out, and so has the two other presenters. But I just want to go back to some of the services we offer at Help and Shelter. Carissa would have mentioned some, but I just want to add to it. We do have a shelter, but that's for women and girls, or for women and their children, I should say. We do have court supporting mechanism where we have our counselors would accompany a client or a victim to court. We have our hotline counseling, and that's 24 hours, 7 days per week. And we also have our face-to-face counseling. Our offices are open from 8:30 to 4, Monday to Friday. And we also have a bilingual, or we have a couple of bilingual interpreters to deal with the Spanish migrant population. So we have those, and we have hotline numbers for those. And in addition to our psychosocial services that we provide, we also do referrals. If you come into us and we are unable to assist with your situation, we make referrals. One of our implementing partners, or one of our more important partners, is the Guyana Legal Aid Clinic. We have been working with them for a while. And as Carissa rightly pointed out, all our services are free, and so is legal aid. I think there is a consultation fee for legal aid, but it's not much, it's affordability. But we have to address this problem. And this is not new. This conversation is not new. It has been going on for a while, for a number of years. And we all understand, Kobe, the root causes of it, right? Um, how do we engage more men and boys? That has been a challenge, even though there have been a lot of work in it, that have been a challenge. You may host a workshop, and if you look around, who is coming to your training or to these workshops? It's mostly our women and girls. So you have to meet the men at their own space where they're comfortable. Help and Shelter has taken this exercise to meet them maybe at the sports ground, maybe have conversation in little rum shops, wherever they're comfortable, and they would listen. Men are open to change their behavior. And we have seen, all of us, we must admit, because we have seen some men change, but we are not seeing the change that we would like to see in terms of numbers. So this is where we need to increase our capacity. I think education is still important. Sensitization and awareness in terms of the damage you cause psychologically, physically, when you hurt somebody. And one of the things, and we all know this, Kobe, our women, we also have to change our approach or our mindset in terms of how we grow up our boys. I heard Vanelli talk about the stereotyping, and Chris also mentioned that. But it starts from us as women also. Our behavior, our approach, we have to rethink how we shaped our boy children and our girl children in terms of stereotyping them. How do we go forward from here? And again, admittedly, we have seen change in behaviors, but we need to see more. We need to see this, and we need to see this across the spectrum. How a boy relate to a girl, and this can start, it has to start in the home. It has to start, it begins in the home. When you wake up in the morning, what do you say to your children? It doesn't cost you anything to say, I love you, how was your day, and so on. So they take this into their adulthood, into their teenagehood, and this is a reflection of what that home environment is. So I think we have to really, really strengthen what we do and what we say in the home environment. Yeah?
Definitely. Definitely. And, so true and so real that we've having this conversation for such a long time. And I remember there was a couple of years ago, I was doing a session at a Georgetown school. I can't call the name because we're going to identify schools, but it was with a second form class, and we were talking about, can't remember what the topic was, but I think it had to do with something with violence, because there was this young man, he wasn't older than 11. Because if you're in second form, you got to be like 10, 11, maybe 11, 12. And we were talking about his colleague who's female, who's female. And he said, if she misbehaves, she got get it. And so I said, what do you mean? I said, if you're at home and your mother misbehaves, what happens? He said, well, if she misbehaves too, then she got get it too. And so like, I just paused because like, what do you say after that? But thinking back, I mean, it's like 6 years later, 5 years later, I don't entirely blame the 12-year-old for his views. I really blame his environment, his culture. What exactly is he seeing? Because if you were 12 and you were thinking that anybody who misbehaves got to get it, whether man, woman, old or young, it means that you don't just wake up. You don't just wake up and have that in your mind. You're not just born. You don't just born with that kind of mindset. And so it really means that we have to go in communities and in homes to really see and seek and really root out those kinds of negative, toxic kind of mentality and beliefs in young men and boys. I know we have some comments and questions online, and so I want to refer to a few of them. The first one is actually a comment from Wendy Hazel, and it says, education cannot be a one-size-fits-all. Efforts to give persons in gender-based violence, what programs think I think the comment is not quite clear. Efforts to give persons in GBV what programs think they need to hear will be ineffective. Programs content needs to be developed from inputs from the abused. The comment is kind of not too well put together, but I think the question has to do with how do we try to engage with survivors to have them frame these programs, because perhaps sometimes we seem to think that as advocates and as program managers and so on, we seem to think we know best and we know what survivors really want. And so the comment really was, how exactly do we bring those persons into the fold to have them part and parcel of the intervention? That was one. Thank you, Wendy, for that. The other one has to do with protection for migrant persons, as Carissa would have been talking about. What about support and protection from the migrant population? We recently saw a taxi driver jailed for 13 years for the horrible abuse of a Venezuelan woman. And so our society, citizens in the country are really engaged and they're really seeing what exactly is happening. And so the question that people are really asking is, what exactly are we doing for these vulnerable populations of people? What exactly are we doing for migrant people? What exactly are we doing for women and girls? And so it really means that we have to really and truly do more for those particular groups of persons. But Carissa, coming back to the migrant population, is there any organization that provides, like, I'm trying to find a way to explain it, where you accompany a migrant person to give translation services? Is that available?
Yes, it is. I do remember Pamela mentioning some of the services that Help and Shelter provides, which encapsulates that. Also, we have NCC itself, who is currently rolling out with some of its member NGOs a gender-based violence project, in which one of the primary beneficiaries and targets is Venezuelan migrants. And as part of that support, those migrants receive a person who navigates them through the systems based on their needs. They have translation services. So we have persons who are Spanish bilingual working on the program to provide that support. Court support is one of the key services provided for. I saw the commenter made an example with respect to court matter that's currently engaged in the court. So court support is there so that someone who understands the system is there to walk through the system with that survivor, or to walk through the system with the family of persons who may have lost their life as a result of gender-based violence. There is, of course, as we said, safe shelters for those persons. And we have, for example, CCOG as one of the organizations who provide primarily for Venezuelan migrants that safe space for survivors and their children, as well as, of course, counseling services we provided. We have NCC has 2 hotline numbers, which is 24 hours that persons can reach out to for assistance. And we can even refer where the needs may be wider than what the organization itself can provide. So I can share those numbers perhaps at the end of the program so persons can be aware.
Carissa, can you share those numbers like now? And so
Certainly.
So you can share it now, and then
yes. So
at the end.
We have 2 numbers, 628-7833. That's 628-7833. And we have 637-3319. Those 2 numbers you can get on Messenger, you can on WhatsApp, sorry, or you can send a direct message and the persons will respond, the navigators will respond, the response operators. Or you can just perhaps dial the number, even if we try to meet persons, who may not have a lot of credit, but you want to access. You dial the number, you send a message or somehow, and they will respond to the message, or they will call. So you can reach out to those numbers. It's 24 hours access, and WhatsApp is quite popular. Of course, you can also WhatsApp those numbers.
Definitely. And that's really good to give persons the options, especially in this time when people are busy, they may be working, they may not have the time to come into a particular physical office to interview with someone. And so it's really good that they have the option to engage virtually, whether it's WhatsApp or SMS or call or whatever. And so thank you very much, Chris and NCC, for providing those particular services. We're coming down to the end of our conversation today, but we can't move on without speaking on this point. And I know we touched on it a bit on the previous episode, which has to do with the role that faith-based organizations play in really in this whole response to gender-based violence. And so with some of the time that we have remaining, based on your experience, Valini, Pamela, and Carissa, how do you see faith-based organizations really partnering with NGOs to really preventing, number one, gender-based violence, but also responding in cases where they actually happen? How exactly do you see that working? Because really and truly, we need to have a whole of society approach. It's not just government, as Pamela would have said from the initial stage. It's not just government, it's not just Help and Shelter, it's not just NCCC, because the reality we understand is that all these organizations don't have all the resources, whether human or financial or otherwise, to do it. And so how exactly could faith-based organizations participate in this whole response? Valini?
All right, Kobe, I'll jump in here. Faith-based organizations can play a great role in addressing GBV. However, we need to work with the organizations first, because I can share my experience where I was being practically brutalized. And one of the first places I turned to was my church, my spiritual leader and his wife. And the first thing I was told, that God didn't like divorce. And, you know, the whole submit to your husband kind of thing. And my question was always, how can I submit to someone who is abusing me? We first need to let the faith-based leaders understand that no form of violence is acceptable. I don't think any of the religious books will condone beating or harming anybody, women, girl, boy, whoever. So we first need to let some leaders understand that while we understand you're trying to preserve the family, it's worse to have toxic families. And telling a woman that God doesn't like divorce and basically telling her to stay isn't the best thing to do. So we, again, here, mindset change. We need to work with our leaders to have them really understand the effects of gender-based violence, interpartner violence, domestic violence before they can go out and play an integral part in it. On the other side, many people rely on their religious leaders and eldership in the churches for guidance. So there is where pastors, mages, pandits, and so on can influence change, talk to the men and boys, guide them as to what positive masculinity is, etc.
Great. Thank you for sharing that. Pamela, any thoughts on that?
Yes, Kobe, definitely. You know, I always have to think outside of the box. We have always been engaged in faith-based organization in terms of gender-based violence, domestic violence, family violence, and all of that. But Vanelli highlighted an important point. It's how they take that message, how they process that message, and how they disseminate that message to their followers of the church. I think this engagement or this partnership cannot be a one time. It has to be sustainable. We have to continue the conversation, and the conversation has to continue. The Vinelli made another relevant point that I'm really pleased that she did it. None of our scriptures, the three most important ones, the Bible, the Quran, or the Ramayana, has never ever in anything, words or what, to say you must, violence must be perpetrated towards a specific gender or a specific group of people. None of it. So yes, our pundits or pastors or imam, they have a greater responsibility in terms of at the community base, especially. Kobe, you all would agree with me, Carissa and Vanelli. You travel around this country, you would see how many faith-based organizations we have, right? And we have cohesiveness with them, we have unity among them. But I think the faith-based organization has a much more important role in terms of addressing what we're having with domestic violence and gender-based violence in our society. I think they have a greater role to play.
Thank you, Papana, for that. Carissa, any thoughts?
Well, just to add on what the lady spoke about, now it is important that we engage these faith-based leaders, like Valini mentioned, in our effort to transform masculinities and to prevent GBV and SGBV. Now, we also need to engage our very faith-based leaders to provide them safe spaces for our survivors. And they play a critical role in giving that support, because like Valini mentioned, that was one of the first persons she felt most safe or comforted to turn to when she needed help. So you want to ensure that we continue to work with them. And like Pamela said, it cannot be a one-off engagement. It has to be continuous, it has to be structured. And I think working and building that network between our NGOs and our faith-based organizations so that we have that hand-in-hand support, because a lot of these faith-based organizations are deep-rooted in many communities. And so they are like a first point of contact for many persons, the congregation. And so we want to ensure that we strengthen that network, we strengthen that partnership with these organizations so that we can respond to the needs of survivors.
Thank you for sharing that, Carissa. A very high note, actually. So we have 4 minutes remaining. We're at the end. And I want to give each of you 30 seconds, final thoughts. What would be your key message to any survivor that may be listening, watching us this afternoon? Anything in 30 seconds.
To the survivors out there, thank you for getting out while you're alive. To the victims who are suffering in silence, there is help. You are not alone. Use the facilities available. There is help. Remember, there are places like Help and Shelter and the NCC providing services.
Thank you. Kamala?
Just to add, Kobe, Help and Shelter has a hotline service, and our number is 225-4731. Just to recap that number for anybody that's listening, mostly so the survivors, it's 225-4731. Reach out to us, talk to someone. There's so many supporting systems you have in communities. Reach out, don't suffer in silence, because this is very pervasive. And you have to let somebody know, confide in somebody that you trust. And again, Kobe, thank you for having me on this program. And remember, Help and Shelter is your partner. It's our partner in fighting this domestic violence and gender-based violence in our society. And there is so many help, even if it's not in Georgetown, in the outlying regions. So seek those help, seek those support, talk to somebody. Thank you.
Thank you. Carissa?
I would like to say to our survivors out there, you are not alone. You have a lot of support there, free of cost. All you need is to have the willingness, the strength, and you will receive that support. And once you get into the programs, you will be empowered. We know it is not easy. We know that it's not easy, not even to open up to tell people, and something that truly affects a lot, even in a lot of professional women face gender-based violence, and they don't come out because of the outlook that is there of a professional woman. So I want to say, especially to the professional women out there who may be survivors, who may be dealing with gender-based violence situations, seek help and be strong. There is help. Just reach out, confide in someone, and you will be supported.
Thank you, Carissa. Thank you, Valini, and thank you, Pamela. This has been this has been this has been a production by Miranda Incorporated called Let's Talk Gender-Based Violence, supported by the Caribbean Vulnerable Communities Coalition, CVC. And so we invite you to join us next Sunday for another episode of Let's Talk Gender-Based Violence. And next week, we will be talking about dealing with rigid masculinities and gender-based violence with a panel of men, because as we all agree to today, it is time that we really and truly move the needle in engaging men and boys in addressing and responding to gender-based violence. And so we would like to thank you for joining us. Of course, our flyer today said that we were supposed to have Ms. Bibi on with us, but unfortunately, she had an emergency to attend to, and so we hope that she will be able to join us on another episode. My name is Kobe Smith. I thank you all for joining. Stay safe, stay healthy, and join us in this fight against gender-based violence. Thank you so much.